Disease or illness topic for exam number 3 by Brandy Haskins. Aspergers syndrome. Aspergers syndrome is an autism spectrum disorder considered to be on the high-functioning end of the spectrum. Affected children and adults have difficulty with social interactions and exhibit a restricted range of interests and/or repetitive behaviors. Motor development may be delayed, leading to clumsiness or uncoordinated motor movements. Compared with those affected by the forms of ASD, however, those with Asperger's syndrome do not have significant delays or difficulties in language or cognitive development. Some even demonstrate precocious vocabulary, often in a highly specialized field of interest. Identify population of group, how it develops, or risk factors for developing. We do not know all the causes of ASD, however, we have learned that there are likely many causes for multiple types of ASD. There may be many different factors that make a child more likely to have an ASD, including environmental, biological, and genetic factors. Most scientists agree that genes are one of the risk factors that can make a person more likely to develop ASD. Children who have a sibling with ASD are at a higher risk of also having ASD. ASD tends to occur more often in people who have certain genetic or chromosome conditions. When taken during pregnancy, the prescription drugs valproic have been linked with a higher risk of ASD. There is some evidence that critical period for developing ASD occurs before, during, and immediately after birth, and children born to older parents are at a greater risk for ASD. Pathophysiology and effects on the body. ASD are considered neurodevelopmental disorders and are present from infancy or early childhood. Although early diagnosis using standardized screening by age 2 is the goal, many with ASD are not detected until later because of limited social demands and support from parents and caregivers in early life. The severity of communication and behavioral deficits and the degree of the disability is variable in those affected by ASD. Some individuals with ASD are severely disabled and require very substantial support for basic activities of daily living. Asperger's syndrome is considered by many to be the mildest form of ASD and is synonymous with the most highly functioning individuals with ASD. Two core features of autism are A. Social and communication deficits, and B. Fixated interest in repetitive behaviors. The social communication deficit in highly functioning persons with Asperger's syndrome include lack of the normal back and forth conversation, lack of typical eye contact, body language and facial expressions, and trouble maintaining relationships. Fixated interest in repetitive behaviors include repetitive use of objects or phrases, stereotype movements, and excessive attachments to routines, objects, or interests. Persons with ASD may also respond sensory aspects to their environment with unusual indifferences or excessive interests. Signs and symptoms. The following behaviors are often associated with Asperger's syndrome. However, they are seldom all present in any one individual and vary widely in degree. Limited or inappropriate social interactions, robotic or repetitive speech, challenges with nonverbal communication such as gestures, facial expressions, etc., coupled with an average to above average verbal skills, tendency to discuss self rather than others, inability to understand social emotional issues or non-literal phrases, lack of eye contact or reciprocal conversation, obsession with specific, often unusual topics, one-sided conversation, awkward movements and/or mannerisms. Diagnostic tests required to identify. Diagnosing ASD can be difficult since there is no medical test like a blood test to diagnose the disorder. Doctors look at the children's behavior and development to make a diagnosis. ASD can sometimes be detected at 18 months or younger. By age 2, a diagnosis by an experienced professional can be considered very reliable. However, many children do not receive a final diagnosis until much older. This delay means that the child with ASD might not get the early help that they need. Nursing assessment interventions with rationales. The diagnosis would be impaired social interactions related to autism. The assessment would be patient will identify positive coping strategies such as structuring leisure time. Intervention would be development trusting relationship with patient to demonstrate caring and encourage patient to practice new skills in a safe therapeutic setting. Second assessment would be patient will combine past effective coping methods with newly acquired coping strategies. Intervention would be praise patient for adaptive coping. Positive feedback encourages repetition of effective coping by patient. Medical treatment plan including medications. Psychosocial interventions for Aspergers. According to the National Institute of Neurological Disorders and Stroke, the ideal treatment for Asperger's coordinates therapies that address the three core symptoms of the disorder: poor communication skills, obsessive or repetitive routines, and physical clumsiness. There is no single best treatment package for all children with AS, but most professionals agree that the earlier the intervention, the better. An effective treatment program builds on the child's interests, offers a predictable schedule, teaches tasks as a series of simple steps, actively engages the child's attention in a highly structured activities, and provides regular reinforcement of behavior. It may include social skill training, cognitive behavior therapy, medication for coexisting conditions, and other measures. Individual psychotherapy to help the individual learn social skill training, to better detect social cues and how to deal with the emotions surrounding the disorder, parent education and training, behavior modification, social skills training, educational interventions. Psychiatric medications can be used to treat hyperactivity, inattention and impulsivity, for irritability and aggression, for percussion, and for depression. Nutrition concerns and teaching. The best approach to solving problem eating behaviors, according to Elizabeth Strickland, author of the book Eating for Autism, the 10-step nutrition plan to help treat your child's autism, Asperger's, or ADHD, is to assemble a feeding team, a group of healthcare professionals consisting of a physician, speech-language pathologist, occupational therapist, behavior therapist, and an RD. A dietitian can evaluate the foods the child agrees to eat for potential dietary deficits. He or she can watch the child and family during meal times to assess habits that may be hindering food intake. An RD also can screen the medications the child takes that may have side effects that contribute to feeding problems. Just as problem eating behaviors can prevent ASD patients from getting the nutrients that they need, so can consistently consuming highly refined foods. Since highly refined foods may contain artificial dyes and preservatives that could be associated with aggravating behavioral symptoms in those with ASD, suggesting the family eat natural whole foods may be an important treatment intervention. Dietitians working with ASD patients can recommend eliminating the following substance from an ASD patient's diets if they believe the sensitivity exists: food dyes and artificial colors, high fructose corn syrup, artificial flavorings, artificial preservatives, and artificial sweeteners. Patient education and plan of care. Nurses are in a position to identify children with Asperger's early. After identification, the necessary referrals, treatment options, support, and follow-up are essential for these children, such as previously discussed. Arrange for the child to be in a room away from the noise and hustle-bustle of a busy unit. Develop and implement as much routine and consistency into the child's schedule as possible. Allow plenty of time to work with the child. Provide for time and support in dealing with transitions, moving to a different room. Use clear, simple language. Coordinate plans of care during hospitalization with team members who have been involved with the child prior to the hospitalization. Coordinate plans for discharge with the parents and caregivers and all others who are involved in the child's care. For a child who may need to be hospitalized frequently, develop an individualized healthcare plan that can be used for subsequent hospitalizations. Discharge planning and considerations. Assess patient's ability to return home. Who will be available to assist patient? Can patient follow up with care plan or will need assistance? Contact a social worker if needed to assist patient or family members. Provide information to patient with community resources and or start the communication process by initiating calls to such programs as cards. Here's some videos that I felt would be helpful for understanding the different aspects of Asperger's syndrome.
Should autism and Asperger's be considered separate disorders? The debate in the medical community rages on. Hey guys, this is Annie guest hosting for D-News. This week, the Scottish singer Susan Boyle made headlines by announcing her diagnosis of Asperger's syndrome, opening up new conversations about the often misunderstood condition. Asperger's is characterized by difficulty in social interaction and nonverbal communication, and in some cases clumsiness, atypical use of language, and other symptoms. And currently, it's considered part of autism spectrum disorder, a diagnosis that's increased significantly over the past 2 decades. According to the British Medical Journal, autism diagnoses were rare in the UK and the US until the 90s when the rates began surging. They've since leveled off in the UK, but according to the Center for Disease Control, autism rates have continued to grow in the US. As of 2008, 1 in 88 children were identified as being on the autism spectrum. The spectrum contains a range of conditions characterized by social and communicative challenges and certain behavioral patterns. ASD is about 5 times as prevalent in boys as in girls. The spike in rates is not fully understood, though it's been suggested that the spike is related to increased awareness and changing diagnostic standards. What the autism spectrum entails is still being hammered out in the medical community. Earlier this year, for example, Asperger's syndrome was removed from the DSM-5, which is the manual that psychiatrists use to diagnose. It was folded in with autism as basically a higher functioning form of the disorder. Asperger's patients don't typically suffer from cognitive or linguistic impairment and are often above average intelligence. Still, newer research finds that there may in fact be significant biological differences between Asperger's and autism. Harvard neurologists and psychiatrists measured brain connectivity among Asperger's and autism patients using a measure called EEG coherence. They found that this measure could be a distinguishing factor, but that larger studies are needed, also pointing out that those differences can have huge implications for patients, their families, and their caregivers. As always, let us know your thoughts in the comments. For D-News, this is Annie.
Hi, my name is Joe Groves, and when I was 15, I was diagnosed with Asperger's syndrome, which is on the autism spectrum. In the media, many people see disabilities, like autism, as something that impedes their quality of life. Now, while I'm on a high-functioning end of the wide spectrum, and I don't face the same obstacles as people on the other end do, I want to show you that my disability actually can enhance and enrich my life. I work as a web and graphic designer at a small digital media agency called Barclay James, close to where I live. I get paid to do what I love. That includes IT, computers, design, graphics, film, photography. In the main, when you work in any office, your work colleagues kind of become your surrogate family. After all, you do work with them for like approximately 10 hours a day, most days. The purpose of this short documentary is to show that having a disability like autism or Asperger's isn't just a negative, it doesn't just impede on your life, it can actually bring a whole new dimension to your world, and in this instance, your office. Typically, I've found in the past that people like me with Asperger's or autism find social communication and interaction very difficult because they don't quite understand social convention.
So you're not around personal space, so you're just talking to someone in here. It's like, oh hi, and you can look behind me, making noises down my ear. Yeah, down the ear.
Full drinks, full glass, always mix the glass. Oh, he's a very messy eater.
You don't mix them up all the time, there's no off-message.
Jolly fun, and great to work with, one of the most reliable individuals I've ever known. He doesn't act or say the inappropriate intentionally. If he does, it's very rare. Very rare. I've learned to use my sometimes inappropriate behaviour and turn it into humour. I think the one thing that he seems to love to do to me is I'm at my desk, typing away, doing my work, and he seems to want to stand unbelievably close to me, the back of my chair, which is actually quite off-putting because where my chair is, there's only a gap of probably